And we're back, set for our first major conversation now. When we talk about brain drain in Nigeria's health sector, usually we hear the focus on medical doctors. We usually see the focus on medical doctors. However, according to the latest report on the number of professionals on the NMC register, if you wonder what NMC, you'll learn about that in a bit. Well, from April 1 to September 2022, these figures are obtained from the NMC register. The NMC is the Nursing and Midwifery Council. It's a United Kingdom body. A total of 1,670 Nigerian trained nurses were licensed to practice in the United States and United Kingdom within 6 months. Yes, now the NMC is the regulator for the nursing and midwifery professions in the United Kingdom, and it maintains a register of all nurses, midwives, and specialist community public health nurses and nursing associates eligible to practice within the United Kingdom. Now, experts had warned that if urgent action was not taken to, avert brain drain in the country's healthcare system might fail or fall to its knees. According to the NMC, the Nursing and Midwifery Council in the UK, there were a total of 771,000 nursing and midwifery professionals on its register as of 30th September 2022. Now, of this number, 8,891 were educated in Nigeria. And in the 6 months to 30th September 2022, 1,670 people who were educated in Nigeria joined their registers, what they're saying, for the first time. Also, between April 2021 and March 2022, a total of 23,444 people who trained outside the UK joined the NMC register for the first time. That is 13,482 more than the number who joined the previous year. The report also added that the number of nurses and midwives who trained in Nigeria joining the UK register for the first time during the period under review was 3,010. Of these, 2,998 were nurses and 12 were midwives. Now, Nigeria was ranked third with the highest number of nurses and midwives registered in the UK NMC register after India with a total of 9,769 and the Philippines with a total of 5,763. The data shows a steady number of monthly joiners from outside the UK, with more than 2,000 internationally trained joiners each month. Joining us once again to talk about the overall issue of brain drain in the Nigerian health system, we're glad to have Abraham Great, who is a public affairs analyst. He joins us live from Canada. Abraham, good morning to you. Thank you very much for your time.
Good morning, Mr. Bartels. How are you doing?
Very good, thank you. We're hoping you would have come home to to vote, but of course we understand how these things can get, and it's great to have you on the program this morning.
Well, first of all, I want to thank you for the opportunity. And yes, I would have loved to be there to vote, but I have a parental responsibility here that has kept me here.
Absolutely, absolutely. I know you're actively participating in your own way from there. I'm sure about that.
Definitely.
Yeah. Okay. So for these records, from the UK, we're talking about nursing and midwifery professionals. We used to talk, last time you were here, we were talking about medical doctors. This time we're talking about other health workers. Now we hear about the NHS in the UK and all that. Why is it such a big deal, the United Kingdom having and attracting medical workers, not just medical doctors, but health workers from other parts of the world like India, the Philippines, and Nigeria? What is the big deal about the UK's health system and health sector?
Now, I would like to say this, that there is to address the healthcare problem in Nigeria will take more than a generation and a half. So by that I mean it will take over 30 years. That may not be good news for Nigeria. And there's no quick fix to major problems in major countries. So what you have at the minute is that if you were a nurse or you were a doctor, the primary reason why you went to school actually in the first place might not be, maybe, I mean, four out of every 10 people going for nursing school in Nigeria have diaspora in their mind. So while they are studying, they're actually looking to travel abroad. But let me quickly say this also, that I've got some noise in the background that is really affecting me to communicate properly. So I don't know if you're aware of that. Just to be able to take care of that. So so it is extremely difficult to be able to fix the Nigerian healthcare JAPA issue because of the fact that, number one, there are no infrastructure for the people to feel the work they are doing in Nigeria. Remember that the expectancy rate in Nigeria is also very low. So Nigeria has not even come close to prioritizing solving the healthcare problem at all. You will recall that the last time we spoke about this, I postulated, I brought up the Maslow hierarchy of need. As Maslow postulated that the first human need is the physiological need. Nigeria has not even come close to solving water problem, breathing problem, electricity problem, just the basic number one need of human need. So because of that, you have people aspiring to go to other countries. But now let's look at the back end of it. Why is the UK itself, taking, brains from different countries? The UK is also having a major JAPA problem. So one out of every four people that you find in Australia, like I said before, are from the UK. So a lot of people, because of the inflation rate and the way the economy is going in the UK, a lot of British people are leaving. The other thing is the age in the UK. The UK citizens are getting older, and not a lot of them are going into the sector to be trained as doctors and as nurses. Now, Nigeria is in the top three countries that UK wants. Number one, because we have a good education system. Theoretically, we're very good, whereas in practical, we're not as good. But because we spoke or we speak very good English, UK is always looking for to bring in Nigeria. Now, something significant happened in the UK in 2016 when we had Brexit. Before Brexit, you have influx of people from European countries coming into the UK, and they could take up, a percentage of the jobs, the shortage, occupation like nursing. But after Brexit was enacted in 2020, December 2020, and the UK finally left the bloc, a lot of those people not only went back home, they cannot come in and work as easily as before. Where does the UK turn to? The UK turns to India, turns to Pakistan, turns to Nigeria. So this is why we're having the problem that we're having.
What are the, apart from the economic, the difficulties that you've talked about, they have a jackpot syndrome. Some would say that the need arising for a lot of health workers, even I saw one advert, it's been on Twitter for some time now. They're looking for people who are specialists in taking care of the elderly, apart from the issues you face, I think that you'd agree that they have a system that somehow works, the NHS, and they have a sort of a health insurance. Can you break that down for us? Because you're a former resident of the UK. This system that makes it necessary to have a lot of health workers, and they are paid well and taken care of well, and they take care of their citizens. Maybe we can borrow one or two things from that.
Well, the first thing is that the country has a very good planning system. And health is the priority in the UK. So I give you an example. In most part of the world, you need health insurance to be able to take care of your health. The UK is different. The UK health is completely free. That is to tell you how health is prioritized. If you are a UK citizen or you have a work visa or you have student visa, once you live in the UK, your health is free. It doesn't matter what is wrong with you. So the UK government prioritized the NHS above everything else in the country. Is the baby of the country. The health of everybody living in the UK is a priority. It is after this government, the conservative government, when they came into power in 2010, that is when, for the first time, foreigners are charged, immigration health surcharge. Before then, by the time we got into the UK over 20 years ago, you don't need to pay anybody. Even if you came into the UK on visitor and you you are sick, you'll be taken to the hospital and at least be treated. So it is the lack of priority. Nigeria has not even come close to prioritizing health at all. And this is why I make in my first submission that it will take a decade and a half for us to even come to having hope that Nigeria can fix the issue of our health workers leaving the country. If I were you, or if you were me, or if it was your sister or your brother that had the health qualification that is needed in a country that the currency is 1 to 900, would you tell them to wait? Would you tell them that your country needs fixing? People are dying of hunger in Nigeria. People are dying of unemployment. There is no remedy there is nothing we can do. There is nothing. In fact, if Nigerian governments try to stop people from going, it will be another agenda of evil.
But
Because one person who leaves the country is able to help many more people back home. Nigeria is not ready to solve the health problem. We have not even solved electricity.
should, should,
So
should,
if we cannot fix electricity, if we cannot fix road, we can't even build hospitals.
should the UK be compensating Nigeria? I made a point to some health workers some time ago, medical practitioners actually, that the government somehow subsidizes their training somehow. Government takes up their training at some point. If you're a nursing student, you're a medical student, you're a medical lab scientist, or whatever. At some point, there's some sort of ownership that government takes of you, even to the point of probably employment. Should the UK be compensating developing countries like Nigeria? Like now we are least developed because president is attending a conference on least developed countries, so we can call ourselves that. Should the UK and countries like that be compensating Nigeria and countries in that bracket for taking away our medical workers, our health workers?
I agree with you totally on that. And I'm trying everything possible to see how we can influence a great Nigerian, the Minister of Diaspora, Madam Dabiri, to see how we can effect in the new proposed or in the proposed diaspora bill to have a situation where the countries that are taking our talent can pay the country back some sort of taxes. So, for example, in the UK, tax is 20%, 21%. We pay taxes and then we pay national insurance. So we're not asking for their taxes, we're asking out of their national insurance. So if you charge 13%, for example, for the national insurance, can you pay back to the sending country like 3%? So if you're taking it on a monthly basis, £300 from somebody's salary, we're asking that you should give us, a percentage of that to develop our health sector. There are millions of Nigerians outside of the country And if we can have a portion, a fraction of the insurance in America is Social Security, in Canada is social insurance number, SIN number. So out of the contribution to the insurance sector, we can have some money repatriated back into Nigeria, and that money can go directly into developing our own health sector. Similar to what the president-elect was saying as per OPEC, and the way we relate with the West, our foreign policy now needs to be a lot firmer, and we need to have a better bilateral relationship with some of these countries that we are sending to.
Some experts are saying that if urgent steps are not taken to address the country's health system, especially as it relates with this brain drain, that Nigeria's health system will fall to its knees. It will collapse. However, we want to backtrack a couple of years ago. The Minister of Labor and Employment, who incidentally is medical doctor Chris Ngige, said that Nigeria has more than enough health workers to withstand any brain drain. What are your thoughts on this? Are we facing an imminent collapse of our health system, or do we have enough personnel to replace those who are leaving?
I would agree, even though I don't agree with on many things, but on this I will agree with him. Nigeria does not have human capital problem. We don't have a problem.
All right. I think network quality has interrupted. Very interesting conversation we're having with Abraham Great, rather, who's a public affairs analyst. Beautiful thing to have Abraham, because he has the benefit of having experienced at least three medical systems: that of Nigeria, that of the UK, and of course now he's in Canada. So he has the experience to be able to give us a broad view. But before he went, last thing he said was that he agrees with Ngige, Chris Ngige, who's Nigeria's Minister of Labor and Employment. Where he spoke during an industrial action or strike by medical doctors in the country, he said Nigeria has enough to replace those who are leaving to seek greener pastures abroad. So our guest analyst this morning says he agrees we have enough. But the question is, what is the state of the nation's health sector, that is causing these people to leave? Now, of course, they're leaving for economic reasons, but some are also leaving not just for reasons of the national economy, but their personal economy. So I think our guest touched on that a bit before when he started in his first submission. And what we're hearing a lot of experts put out as a major reason why they're leaving, not the general national economy, but their personal economy. Poor remuneration is a point that is raised. They're not paid well. They're not paid well. So if they're not paid well, like he said, when they have an opportunity to go to a country where £1 is 900 naira, on the parallel market, then they will jump at that opportunity. So the first thing that some of these experts talk about, is they say brain drain is largely driven by poor remuneration. Then you also have poor working conditions and a heavy workload. As a particular teaching hospital, I have visited many times. Now, one day I sat back and said, wait a minute. 2, 3, 4 years ago, I used to come to this teaching hospital. I would see about 5 or 6 nurses on duty in one ward. Let's say 5, okay? These days, you see maybe 2, sometimes 1 in an entire ward. And when you see them taking care of patients and all that, you see them sweating. I saw one, she was sweating, and then some of them, even the patient ones, lose their cool at times. They go through a lot. And if you talk to medical doctors, I mean, I used to be in the category of people in this country who used to feel that medical doctors were really well paid. For you to be a doctor in Nigeria, it's not true. It's not true. Medical doctors are poorly paid. And if you hear some of what they get as salary, you'll puke. It's really sad. Anyway, we have to go. Yeah, we'll keep talking about this issue of brain drain in the health sector. I mean, you can't fault people who are living for a better life, but our system, a health system in the country is on life support. It's on life support. They need to take it to intensive care unit, take it to the theater and operate on it so it can be resuscitated. That's the size of our package for now. I hope you enjoyed the program despite the challenges. Don't forget to follow us on our social media pages at PlusTvAfrica on Facebook, Twitter, Instagram, and YouTube. We have a second channel on YouTube, which is PlusTvAfrica Lifestyle. You can watch us on various platforms, but do ensure to stay with us throughout the day because we have wonderful programs coming your way. Till we meet again, my name is Kofi Bartels. Good morning.